Hi, Donna. Hi, everyone. Hope that you're all having a good week. So on today's webinar, we're going to be talking about common questions and talking about how that data is going to be used and some of the logistics around that. And something that you all have heard a little bit about and have questions about, and I've heard great things from the TA team that you guys are making great progress and thinking about the data that you want to be collecting, so I know that this is really timely for many of you. So to kind of zoom back a little bit to the bird's eye level, there's a few different data collection activities that are happening within the scope of the demonstration project. So obviously, the participant data that you're collecting is the core component of the data collection in the entire project. So secondary data that is really useful for providing context for your work and for interpreting your evaluation results. And that's what we're going to be talking about on next week's webinar on Thursday, I believe it is. And so we'll put a pin in that for now. And then the third piece is the organizational data. And so that's really the information that we're collecting from you all in that capacity survey that we sent out. And that's really helping us understand the needs of your organization and how we're helping to build your capacity over time. And so thank you to everyone who filled that out already. And just a plug, if you have done that, we really appreciate you taking the 20 or so minutes to fill that out in the next couple days. And for today's webinar, we're going to be focusing on the participant data. And this data is going to be used in two ways. This way, the primary way is for your evaluation. And so you're collecting the data and going to be analyzing that data with the help of your TA provider. So that's an obvious piece of how that data is used. The second piece is Enterprise doing a broader analysis of the data that's collected, analysis of those findings, and this really relates back to that goal of contributing to the evidence base and kind of pulling all of that collected data together. And so this is a context in which we're talking about adding the common questions. Because so much of what you're collecting is really specific to your organization, the common questions create an opportunity for us to have a few select questions that are being asked of all participants or residents or community members that are the focus of your evaluation. So about the common questions, as I said, it really provides a great opportunity for us to have consistent measurement across all 20 of your organizations. And when we were crafting them, we were really careful to ensure that they were general enough that they apply to all 20 of your projects or programs, so that it's not an awkward fit trying to shove a square peg into a round hole. We were also really careful to make sure that they're limited in number because we want to minimize reporting burden, and we know that you have a lot of questions and that you want to gather from your participants. And so these general principles really guided our decision on what these common questions should be. They needed to be relatively easy to answer, and they really needed to fit into these broad questions that we wanted to be able to analyze across all participants. And so the first one that we have here is please think now about your personal health. And then would you say that in general, your health is very good, fair, or poor? And so this question, not surprisingly, is about perception of health, and it is part of the existing success measures tools. So you may already have considered this or have this as one of the questions that you'll be collecting. And really the power of this question is being able to ask this across all of the participants that are participating in this program and that you're surveying, and really being able to aggregate this information about their perceived health, not just at one point in time, but over time. And for any of those participants where it's the same individuals that are participating in both rounds of your data collection, being able to see that change over time and then aggregate that up. We were thinking about the rationale for including this question. We were really thinking about just that power of being able to measure perceived health status across such a large and diverse sample of population. And I know there's a lot of other questions that you're all getting at with relate to the specifics of the health outcomes or social determinants of health you see changing as a result of your program. This is a way for us to capture that one consistent question on health across all of the participants, and again, to do that over time. The second question that we have is actually a new question that we created for this project. So I'll read it to you because I know if I don't, you're reading it while I'm saying other things, and then you won't get a chance to know what I'm saying. So next, we would like you to consider some factors that may or may not affect someone's health. In your opinion, how much of a possible effect, if any, can the following things have on a person's health? So then the option of ranging it from none to a lot. And the different factors here are the extent of their physical activity and exercise, their level of financial security, the amount of social support they receive from their family, friends, and or neighbors, the condition of the housing they live in, their feelings of confidence and or empowerment, the degree of safety in the community, the environmental conditions such as water, soil, and air quality, the availability of healthy food, the convenience of public parks and green spaces. And then the spot at the bottom, which is completely optional, in your opinion, one other factor, if any, can possibly affect a person's health. So it's something else like smoking or living close to a center or whatever else they think of, they would be able to write in one answer there. And the one thing I'll say about this is the questions that we're asking everyone to use in the form that they're written. If the introductory text where it says next, we would like you to consider some other factors. If that doesn't apply because you're fitting this within another section of questions that it naturally aligns with, then that's something that you could talk with your TA provider about the specific wording of that question. The team was working on creating this. They actually started with a list of over 20 factors, I think, and worked really hard to narrow it down to these 9 factors that we think are most meaningful for measurement. And so this really creates an opportunity to see how folks are thinking about these different factors, which really are the social determinants of health, and how closely they see them aligned with health itself. And one caveat we want to give here is that there's no right or wrong answer. If the residents or participants or community members that are taking your survey indicate a little or none for all of these, that's okay. If anything, it means that they're answering your survey honestly. And so this is not meant as a grade or any kind of comparison. There's no right or wrong answer that we're looking for. This is really just a way for us to probe deeper and see how people do connect these different factors with the idea of health. This I already said, really helping to understand how they're perceiving the alignment of these different factors and how they're seeing the connection between the social determinants of health and individual health. This is something that we've talked about among the demonstration project participants at the convening and on the webinars, but really getting a chance to understand for those people that are receiving the benefit of your programs, how they think about and conceptualize these connections. And this question intentionally focuses on a person's health, not their own health. So it encourages them to think a little more broadly about these connections, and so it introduces less bias about their own personal health. With that, I'll pause and just see if Jessica wants to throw in any other comments about those 2 questions.
So I think, Lee, that was really clear. I'll be interested to see if the participants on the call have any questions. The only thing I would add is just to underscore the point towards the end, which is, we worked really hard to try to figure out what common question made sense against all the very different types of program strategies you all are evaluating as part of the project. And where it came out was the overall health question and really helping us to understand, and we thought it would be adding to the field to sort of understand what respondents, what community members, what clients of community development organizations think related to the social determinants of health, because community development's contribution to health is pretty early in that arena. So understanding how people perceive that, at least through this project, we thought would really add to the evidence base for pursuing that kind of work.
Thanks, Jessica. So the last of the common questions are these three. So I don't have the specific questions written here. They are part of the existing success measures tools, and so we'll have access to them. And if you have any questions about how they're worded, we can follow up after on that. So it's asking about age, race, ethnicity, and then gender. And the gender identity question is written in a way that is kind of appropriate for our current cultural context and how people think about gender identity. And so these questions that we added in are going to be really important for interpreting the other common questions that we've covered previously. It allows us to answer questions like, how does the perception of someone's health differ by these key demographic factors? Or how does their perception of the connection between social determinants of health and health vary by these key demographic factors? It also provides context for your evaluation as well as for the analysis of the findings across all of the that we're going to be aggregating across the entire demonstration project. And so these are really key ways for us to be able to draw context and to better understand any variability within the responses that we're getting to see if it plays out differently among these different populations. It's really it on the common questions. If you count the second one as one, even though it's kind of 9 subsets of questions, if you count that as one, there's 5 common questions: the general health, one around the perception of health, and these 3 demographic questions. So before we talk more about how the data is going to be used, Jessica, do you have any additional comments on those demographics?
Just to say that I think my understanding from talking with Karen and Melissa is that most of you already collect data, so that it doesn't need to be an additional piece of something that you ask a respondent. We can work on ways to tie in existing data using a respondent ID, so that that's something that staff can do, so it's not an additional burden on the person answering the survey. So I think we'd like to address that at the individual group level. But if anyone has any questions about that now, that's fine too.
Great point, thanks. So on the side, we're asking that these questions are added for all the data collection that you're doing, and we're asking that you put them in the format that they were worded. If you have any questions about how to integrate these from a conceptual standpoint and kind of where they need to be within your tools, then you can talk to your TA provider to figure that out. Our hope is that some of you are already asking a few of the questions that we covered, and so in some cases, the only additional question will be the one that was really created for the demonstration project, which was one around the perception of health for these different factors. So in some cases, you will only have that one to answer, or the one to add in. And think a bit about how the data is going to be analyzed and reported. I know some of you are wondering about that. So all of the participant data is going to be anonymized. And all of this data for the common questions as well as the other questions are going to be reported in aggregate. And again, it really adds to the power of the results and our ability to contribute to the evidence base with having these few common questions that are gathered across all 20 organizations. For the common questions, we may also analyze and report on findings for relevant subgroups based on either common interventions or populations served, even geography. So that's something to keep in mind. But again, everything is going to be anonymized by participant, and when we are reporting on any results of an organization, we would, in reporting that comes out, will only identify a specific find your organization if we have your permission to do it. So our intention here is not to take information around your participants' option of health or change in health status and to talk about that for one individual organization. The goal here is really the aggregation of the data. And the other goal is just to identify trends in the data, if there's any variation in perception of health by key demographic factors or by other information that's collected. Another thing to keep in mind is that this is all going to be analyzed and reported in context, so there's no value in talking about any of these individual common questions in isolation. And so as we talk more over time about the role of secondary data, keep in mind that Enterprise is going to be doing a lot of that analysis for all of the data that we're aggregating so that everything is really presented in context of the communities that you're working in and the populations that you're surveying. So it's not going to be used to make a kind of comparison of either your organizations or your interventions. There's really no, there's part of this that's meant to be kind of comparative in any way. And again, we're not going to share any confidential information about your participants, organization, or your program. And all of the information is going to be shared with the participants in the different convenings that we're going to be having, as well as on webinars. And if we do any kind of aggregation of results, let's say for the 4 groups in New York City, and if that will be included in the report, then we would have a call with the groups in New York City to talk through that. Similarly, if we were to analyze some of the data and have findings for a subgroup of organizations that are serving seniors, and we would have a conversation with you all about that in advance. And so we really view you all as partners in kind of interpreting and presenting the data in context of the work that you're already doing, not add on to add any more onto your plate. And so there will be a national report published in 2019 at the conclusion of the demonstration project, and that will reflect the common questions as long as the other data, as well as just findings and insights on how we were able to build capacity and kind of other elements of the project. And so that will all come out at the project's conclusion. So on content around the common questions, we wanted to leave plenty of time for any questions that you guys have on this or on any other part of the project, since we have Kate and Jessica and I think Nancy on the call today. So just a couple of reminders, next week's webinar, we'll be talking about secondary data sources. There is another webinar next week that's looking at creating evaluations and putting data into SMDS. As a reminder, just to complete your capacity building survey if you haven't, and a thank you if you have. So Jessica, do you have anything else to add before we go to any questions?
What I would add is actually in relation to at least one of the questions. So I wait till you're ready to do that. I wondered if maybe, okay, so I wondered if you talk a little bit about how you're going to treat the participant data from organizations in the report. Could you talk a little bit about how you'll report on the capacity piece? Will organizations be identified, you know, how it's not clear it is, you know, those types of things?
That's a good point. So all of the principles that we talked about here with not being comparative and not calling out specific organizations, that applies for both the data that you're collecting through your evaluation and common questions, and it also applies to the capacity building piece. So again, the primary goal for the capacity building piece is to add the data for certain subgroups of organizations that are have particularly similar experiences or kind of content environments in which they're working. Then it may be really valuable to break that out and say, you know, for these 11 organizations, this was a way that their capacity was able to be built through the project, and maybe what it looked like. But that would all be reported in aggregate. If there are instances where we would want to share something specific to an organization, then we would get an organization's approval to put that in a report. And it would be in the form of an aha or a success story. We in no way will be using the capacity evaluation to be comparative or to really share with outside parties what your capacity is. It's really about, for our team, understanding where capacity is built, what does that look like within your organization, and what were some of the things that we did to make that happen, and then reporting on that across the entire demonstration project.
Yeah, I think Lindsay.
Yeah. Any other questions?
No. Regarding survey question number 2, is it located in the Tools Manager? Where else can pull it easily to add it in?
See, I'll take that one. So the answer is not yet, but it will be. We will add the additional questions to SMDS as a tool so that you can pull it right into your survey. We'll add an email note when that's done so that you know when to do it.
Okay, and a couple more survey questions. Your survey for the grantees. You'd like each grantee to submit once for their organization?
We would like each participant to complete a survey. So we hope to get 40 responses because there's 2 of you for each organization. Although there was someone that left one organization, so maybe 39, but you'd like both of the participants from your organization to complete the survey.
Oh, and a reference to the answer to the first question on adding the question number 2 to the Tools Manager was a question on when that would be added?
I need to confer with the people who add the tools, but my guess is that we could get done next week. It's going to be longer than that. I will let you know because you are ready to go with your surveys. Be sensitive to that.
And one of our attendees is asking if you could resend the survey link.
I'll send out a reminder with the link.
Okay. If we get additional questions. Again, waiting, just a reminder that the session has been recorded in case you have missed any part of it or want to revisit. We'll be sending the recording link out to participants probably Monday or early next week. Next question is a way to check if we've already submitted the survey.
You can check for you, I believe. I think Erin can do that. I don't think you can check. So if you have any questions on whether you've done it or not, you can email me. This is Lindsay, and we can let you know.
Waiting if anything else comes in. We may be typing at the moment. While we wait, Lily or Jessica, do you have any wrap-up words for us?
don't think so. I think we are just really excited for where you all are in the process. I know you've been putting in a lot of hard work to move your evaluations forward, and so we are just looking forward to getting the survey responses back from you and making sure that we use that to inform our plans for the next couple months and the convening. And certainly if you think of questions around the common questions after this, reach out to us.
I would echo Lindsay's excitement about kind of where everybody is, especially for me coming back from maternity leave. You were just selected and now you're already doing evaluation plans. It's really neat to see that. I think the other thing I would add is we're going to be reaching out to you to sort of figure out what the topics will be for future webinars that are of interest to you, and we're talking to Karen and Melissa as your TA providers who kind of ear to the ground more than we do. But feel free to email them or us with things that you feel like you're really interested in hearing more about, because we want to keep these topic and of use in a way to each of you.
Yeah, absolutely.
Okay, and there are no more questions. So with that, I think we've hit the end of our session. Thank you to Lindsay and Jessica for your participation today, and thank you for all our attendees. We hope to see you online very soon. Goodbye.
Thanks.